A very good evening to one and all present here today. I'm sure you all had a wonderful, healthy, and relaxed day. And now we are here to give you a wonderful evening too. We will make sure you enjoy this evening and get rich with lot of knowledge. This is Winnie Sandhu from IWSA headquarters for conducting today's program. I thank you all for being here with us this evening. Dear friends, I would like to share with you our today's program. I have the privilege of giving a short introduction about our organization. Next will be the introduction to Science and Awareness program, and under that it is Science and Our Life. After that, Tripta Tiwari ma'am will welcome the participants and introduce our today's speaker, Dr. Major Bishwadeep Paul. Then will be the most awaited talk by our speaker, Dr. Bishwadeep Paul. After the talk by Sir, we will have question and answer sessions with the audience. In the end, we will be vote of thanks will be given. Dear friends, now I take your permission to introduce our organization, IWSA. Friends, IWSA, that is Indian Women Scientists Association, is all India social welfare, voluntary, non-profit, non-political, charitable, secular organization. Our objectives are taking sciences to masses, developing a scientific temper in the society, understanding the problems of women in sciences, and many more. The journey of USA started in June 1973 when 12 founder members, all women scientists, came together to promote science to masses. So they worked together and completed the first step of registering IWSA. Their vision was to take science to society using science and technology for the upliftment of the not so privileged ones. Friends, these were those days when they did not have any place to hold their meetings. But still, they conducted a conference where the then Prime Minister of India, Mrs. Indira Gandhi, was invited as the chief guest. Their hard work and dedication is seen today. We have a glorious campus on a huge plot of our own. Over the years, feathers are added to this organization. At present, we have 11 branches all over India with its headquarters in Vashi, Navi Mumbai. We are running many science education programs like science exhibitions for school students, lecture workshops and refresher courses for researchers, popular science lectures at colleges supported by BRNS, member enrichment programs, computer centers, etc. Under society welfare programs, we have working women's hostel, daycare center, nursery school, library, reading room, health center, early child and child care education. Under Science Awareness Committee of USA, we started Science and Our Life lecture series. This is our new endeavors amongst the various other means to take science to the society. This lecture series tries to bring to you speakers from all fields of science who can tell us about the things that we always wanted to know. They help us to understand the basic day-to-day phenomena which affect our lives, topics on health, education, food, history, as well as the marvels of the numerous discoveries and inventions made by humans are being addressed in these lectures. Starting with the first lecture on 20th of July 2020, we have thus far conducted 12 such lectures till date. We have prominent speakers like Dr. Tessie Thomas, Missile Woman of India, Padma Shri, Professor Rohini Godbole, Dr. Astrid Lobo Gajiwala, Dr. Anita Pillai, Dr. Bindu Menon, Dr. Abha Nagral. In the month of April, we had Dr. Jayanti Narayan, a special educator. Each one of them are well known in their own fields. We conduct these lectures once a month, mostly on second Saturdays, and they are open to all. For more details about our organization, please do visit our website, which is www.iwsa.net. I request you all, those who are not the members, please join us as a member of USA. Forms are available on our websites. I feel proud to be the part of 13th talk by Dr. Major Bishwadeep Paul on a very interesting and important topic, importance of resilience during COVID times. Now, friends, it's the time to call Tripta Tiwari ma'am for welcome address and to introduce our honorable speaker. But I will like to take this opportunity to say a few words about her. Tripta ma'am is one of the most active member of Seoul team. In headquarter IWSA, ma'am is co-convener of Science Awareness Committee, but her presence is seen in all the fields of USA. She is a great organizer as we see her work in Seoul team and in member enrichment program of Learning Garden. I request Tripta ma'am to take over. Please, ma'am.
Thank you, Minnie ma'am. Good evening to one and all, and a very warm welcome to everyone. And a very warm welcome to all the participants, members of IFSA, and today's speaker, Dr. Major Bishwadeep Paul. Dr. Bishwadeep Paul is ex-Major Army Medical Corps, physician and occupational health specialist. He is a medical graduate from Pune. He holds distinction in Associate Fellow of Industrial Health and has been the course topper at Diploma in Hospital Administration from Tata Institute of Social Sciences. I find pride in saying that during his 22 years professional career, he has served for 5.5 years in Indian Army Medical Corps, successfully commanding medical units in remote high altitude terrains of Sikkim, Kashmir Valley, and the deserts of Rajasthan across temperature ranging from -29 to +50 degrees Celsius. He then took up a career in occupational health, starting as factory medical officer with Mahindras and Mahindra, with Reliance Infrastructure and Siemens. Currently, Dr. Bishwadeep Paul is with Procter & Gamble as Sub-Regional Medical Director, and his main aim is to spread awareness about occupational health to improve employees' health and well-being. He has imparted training on various health topics to thousands of Indian Army troops, corporate and industrial employees, and health professionals. He has represented India in Germany, Dublin, and Vietnam during various international occupational health meetings. And Dr. Vishwadeep Paul is known in professional circles for his dedication and commitments. He has been dealing with the pandemic in the forefront with his India and regional medical team since February 2020, when Corona first appeared on the scene. Over the past year, he has realized that resilience is the most important attribute to overcome the challenges that we all face. He will also share his experiences and real life stories that will help us to understand the science behind the virus and the vaccine. Sir, over to you. But before Doctor starts his talk, Winnie ma'am would like to give some instructions to the audience. So over to Winnie ma'am.
Thank you, ma'am. Thank you so much, Tripta ma'am, for elevating us about Dr. Major Bishwadeep Paul. We are looking forward to learn from his experiences. A gentle reminder to all the dear participants, please keep your mics on mute and the cameras off during the talk. I also request you all to post your queries in the chat box, which will be answered after the talk by sir. We welcome you, sir. Please, you may start your presentation.
Thank you, ma'am.
Dr.
Thank you
Paul?
so much. Thank you so much, Tripta ma'am. Am I audible?
Yes, sir. Very clear.
Thank you so much, Minnie
Yes.
ma'am. So at the outset, I would like to really thank you for inviting me to this wonderful association, Indian Women Scientists Association, which actually is doing service to the large number of people who are associated with you in imparting awareness through your lecture series. And I'm privileged to be a part of your 13th talk under this series. So today, thank you so much for your kind introduction, and I'm honored to really be here and address the participants today. I may not be as experienced as all of you, but I will try to tell you from my experiences over the past 22 years, as well as the experience over the last year during the pandemic times. And as Tripta ma'am has said, resilience is one of the things that will keep us going and will see us through this new normal. A new normal, we started calling it a new normal last year, and it's still new because we are still learning about it. And as we go ahead, I would like to take you through what does resilience mean for all of us, and then briefly touch upon the science of the virus, because still there is some confusion as to how many days of isolation, when does a person come out, who should be isolated, who are the people at risk. And these are very common questions that keep coming in, and I will try my best to answer your questions even before you put it on the chat box. So I will start my presentation stating that these are unprecedented times, and we have unanticipated challenges in front of us. We are hearing bad news, distressing news from all over, and in between, it seemed that the pandemic was almost over, but now in the second wave, it has come back very viciously, and extremely painful to hear all the sad stories that we keep on hearing in the news and print media. We need behavioral practices which are critical to winning this fight against this deadly virus. And by behavioral practices, I mean we have to be disciplined. Discipline doesn't come out of, it is just a habit. And we should follow what the scientists are all saying. And the things to this, I will be speaking during the later half of the presentation. And we know that this fight can be won only when everyone knows their goal, everyone knows their role, and not try to bypass it in any way. I'll start my topic on resilience, and I would like to tell you about Why do we want to speak about resilience? What is resilience? Resilience is basically how we can go through this difficult times without a breakdown. How do we drive a car over a long distance without the car suffering any kind of breakdown on the highway is something that we ensure for our vehicle. Similarly, for us as humans, we also need our physical and our mental resilience to see us through the end of this pandemic. We all know that life is a roller coaster journey. There are challenges, setbacks, huge losses for many people. It is unpredictable, and many of us do unfortunately have some devastating experiences along the way. If you see that towards the right, we all are in the same journey in this roller coaster ride today. Some of us may be taking it in our stride, the others may be absolutely scared and fearful of what is going on all around us. Okay, so the expressions are different in these two people for the same journey. I know it may be difficult for some, but we need to decide what to be, whether to take it in our stride or to live in fear. We need to know whether these unpredictable times will make us sit inside a shell in a cocoon, or should we look towards the brighter future which is coming up in the next few months. Why do some people crumble while others rise and shine? Why do some people just think of one or two negative experiences in their lives and they think of ending their life? Whereas others, like the person on your right, Yuvraj Singh, who has gone through a terminal illness like cancer and come back strongly to finish to his cricketing career. We see all these characters, all these personalities around us. What is the thing that we need to know is to keep going through whatever comes or whatever challenges life throws in front of us. I would like you all to go back in time and to think about the times when you were at your lowest in terms of you had your toughest experience in your life. You had the very serious times in the past. Just think about it. I'll give you a few seconds to just think about those times, which was the toughest experience in your lives. Each one of us have a different experience. Some of us think that that experience had brought us to a new low. We have never been so depressed. We have never been so unhappy in our lives as we were at that point in time. We were never so fearful at as we were during that time. So, what was the toughest phase of your life? If you think about that time, how bad was it? What was it related to? It was, you say that it was the rock bottom of your life. Was it a thing to do with a loss of a loved one? Was it something to do with a relationship breakdown? Was it something to do with a disease, a terminal disease, or something that we all had an accident or something like that? Who was responsible for this? Was this because of someone else that we underwent that toughest phase of our life? It can be a financial crisis, a legal crisis, a physical or a mental crisis, anything, a medical crisis. So, if we have gone through that phase of our lives, what was the one single trait of yours which helped you to sail through it? You can maybe write down in the chat box, or you can even think about it. What was the one single trait of yours that helped you to sail through the lowest point in your lives in the past? And how did you get over it? If you can just think of that one trait in your minds. I'm not able to see the screen, so I'm sorry, but I would like you to just think about it. These would be some of the things that you would have thought. The one single thing that helped you overcome The worst phase of your life in the past would be anything: faith, faith in God, faith in the Almighty, faith in yourself to overcome that problem, perseverance, persistence. You were persistent in getting through that challenge. You were persistent in overcoming that problem, that failure, that disaster that you had in your lives in the past. There was something called as acceptance. Some of us have accepted that problem. Some of us had a problem that was lifelong, that was a terminal issue. We accepted for it. We accepted that this too shall pass. And what is all this? What is all this faith, perseverance, persistence, acceptance, etc.? It's all that resilience. You did have, and you did work with resilience in the past. So, what does resilience mean to you? I'll play this short video, a 1 minute video, and I would like you to enjoy this.
No sound, even now.
Sorry for that if you did not hear the sound, but I think all of us did see that, and it is all about bouncing back. Am I audible? If somebody can confirm. Yeah.
Yes, yes.
Thank you so much, ma'am. So in the video, you saw that the kids were also speaking about bouncing back. The kids were speaking about what is resilience. Resilience means anything that falls down gets up. Anything that falls down stands up. We have to rise above adversity, accepting the negative outcomes, and still finding meaning in life. We are in a difficult situation, and it is our responsibility in the way how we respond to it. We can choose to respond positively. We can choose not to respond positively to the difficult situations. But do we cope well when these situations look so difficult? Are we tapping into our reserves of hope? Are we tapping into our reserves of looking into the future with that that positivity as to, okay, we are hopeful that all this will end. We are hopeful that this unfavorable situation will transform. This will end. We are hopeful that we have the endurance, the persistence, the perseverance that it takes to bounce back and still carry on with our lives. Resilience is all about survival, and we can all decide whether we want to survive or we want to give up. whether we want to go ahead and look for towards a brighter future or succumb to the thoughts that we might have today. And where does it all come from? It comes from maybe genetics, because sometimes we see that we have grown up also in an environment which was not very enabling. The environment, our childhood, our parents, our teachers, whatever they have taught us makes or breaks us. The wind does not break the tree that bends. So if we have been taught to wait and stay strong till the time the storm passes, I'm sure we all would be looking towards the future. But if we panic and if we give up, it is a very difficult situation then for us to go ahead and carry on from there. Genetics, why do I say genetics? Because we have seen that sometimes the kids behave the same way as the parents do. So if the parents are resilient, the kids are also resilient most of the times. If the parents are always anxious, they do also, the kids do also get that kind of trait of anxiety and also depression at times. There could be other factors, but again, we learn from our past experiences. We know that I have survived that episode in the past that you thought about, and you can survive this one too. Even if you have lost at that point in time, you have lost a loved one, or you have lost that battle at that time, but you know how it was at that point in time, and you know how you can go ahead in the future with your experience. A training is not only classroom training, it is life training. We know where to stop, where to slow down, and where to go ahead with a lot of speed. There's this wonderful saying that is, that which does not kill us makes us stronger. So if we have failed in the past, it is not to be looked down upon. It is a learning. In corporate world, whenever we take interviews of new joinees, and I am an active member of the interview panel, what do we ask people? We don't ask people about what are your successes. We also ask them, along with successes, is what were your failures? What were the learnings from the failures in the past? So if a person says, I have not failed ever, he is not the brightest of candidates for me. If a person has failed and learned to take that in their stride and go ahead, we know that that person is resilient and that person will go ahead in the future as well. But some battles would not be worth fighting. If we have failed in the past, sometimes we have had to let go. We cannot fight everything. We cannot say that I will take on everything heads on. Sometimes it's letting go is a sign of wisdom. We need not consider it as we have been defeated, but yes, resilience can also be letting go, understanding the threats that are in front of us, and then working towards it sensibly to take it in our stride and letting it go. The most important thing in today's times are not the thousands of Facebook friends that you have, not the millions of Instagram friends that you have or followers that you have in social media. It is just your family, your close family, those two friends of yours who you can call any time of the day. Those connections, social connections at work or in the home or anywhere else in the country or even in the world. Just those two friends, two people. If you have that support system and you know that you're not alone in this and you can get over with it. We are also hopeful that we will get back doing this exactly this kind of hug after this pandemic gets over, and we are all looking forward to it. I'm sure you all would be, right? Currently, we are all wearing our masks, keeping our distances, but this is what life is all about: having deep, meaningful relationships. Do we choose the right role models? Currently, many of us are watching the news all the times. What are we looking at? We are looking at all this negativity. But we also have to think of who are our role models in our lives. Our parents, friends, some celebrities, influential people, the people we read about, we might not have met them, or they may be living with us in our homes as well. Are they the right role models? Is what you need to ask yourself. Amitabh Bachchan, all of you know him, I hope. Amitabh Bachchan has been an epitome of resilience if I think about what all he has gone through in the past. We all know that he has had a very, very critical accident on the sets of a film, which caused intestinal perforation. After, along with that, he also had asthma. He also had abdominal tuberculosis. He had a condition called myasthenia gravis, which is a lifelong condition. And moreover, he also had COVID in the last wave. But he overcame it all. Along with physical issues, he also had emotional trauma. He also had financial issues, which which put him in the rock bottom when he was in debt. He was bankrupt, so he was at a new low at some point in his time in his life. In spite of all this, we see him as a super successful character. Had he given up at that point in time when he was facing those challenges in his life, we would have not known him as the Amitabh Bachchan as he is today, and we would have not enjoyed the performances that he keeps giving, amazing, unbelievable performances that he keeps giving, and is a role model to so many of us. Self-affirmations is very important. If you look at this lady who's walking a ramp, she could have done two things. She could have, after the fall, she could have been embarrassed, she could have just gone back, and she could have broken in tears. Now, if you see that she took it in her stride, she knows that this could have happened, had a smile, and then go ahead. Again, you believe in yourself, and you are more than this situation. Situations will come and go, but the person in this situation is for life, is a long-term player. Either it is a survivor's attitude or a victim's attitude. We may have either one of the two. We may keep procrastinating, and we may say that all the people around us are the causes of my failure, are the causes of my ill health, are the causes of my misfortune. But we may also think the other way. We have to be the problem solver in today's times. We have to accept the challenges, be aware of it, gather ourselves, and then go ahead. So start where you are, use what you have, and do what you can. Don't think of the things that you do not have, what you cannot do, and where you are not. I would love to be in a different place today, not in India, because India is in the middle of the crisis today. But I cannot help it. I try to be happy and to make do with what I have in this particular city where I'm living. This is you all would have, and since all of you are scientists and in various professional capacities in the past, you all know that money is not the major source of happiness. Money is very important at a particular stage in life. Money, and the first time you buy things, you buy a car, you buy your first house, the excitement and the kind of glee that you have is unprecedented. The first car, the first two-wheeler, also the first cycle that we had and we give to our kids. The first cycle, the kid becomes so happy. And after that, all the cycles that you give may not make him or her as happy as the first time around. Similarly, buying your first house, your own home, with your own money and your loan would give you so much happiness. But after doing the same thing and elevating to the next level may not give us as much happiness as the first time around. After the needs are met, what are the three happiness sources after your money needs are met? Random acts of kindness, simply going Driving down, looking at the policeman in the signal, giving him a small bottle of water is a random act of kindness. Just doing that fills your heart with happiness. Doing random acts of small kindness like stopping a car for an old person to walk and cross the road is also a wonderful, it gives you a sense of pride and pleasure as well. So these are some things that we give back to society and community. Go to the orphanage, go to the old age homes and do these things. These are amazing happiness sources which cannot quantify with money. Finally, the quality time with friends and family. Unless we have this, people during this pandemic, I have known personally in my organization, PNG, we have had people who were stranded in various cities without anybody because they couldn't go to work, they were not with their families, they were living alone in a house for 3-4 months in the lockdown phase last year. And it did create a lot of stress, a lot of anxiety in their minds. You cannot go out, you cannot meet people. That is the time when we realize the value of friends and family. And these are important people, important sources of happiness in our lives. Goals are important, and this is a slide which I keep showing my people, my team. Goal is very important in a professional career, but in between goals is a thing called life that has to be lived and enjoyed. Goals do give you a purpose in your professional career, but love, career, wealth, health, family, these are all so much more important, and these are the purpose of life. Making informed choices is very, very important while you achieve your goals on a day-to-day basis. And we know that life is all about balance. We may fall at times, but we need to rise and go on. Unless we keep this balance, there might be an accident of sorts. So we all, in this picture, in this video, you see that both of them, the father as well as the child, are out of their comfort zones, but they are both enjoying and both are balancing each other. Both are building up the muscle of resilience here. So these resilience and perseverance are natural characteristics and all. So we are challenging ourselves, going out of our comfort zones, looking what works and what does not work, learn from failures, and go ahead in life. So resilience means mental resilience, where you are aware, you adapt in the changing scenario. We all are resilient today, amazingly resilient. We never knew that we could stay home for so long without meeting friends for so long, without meeting strangers for so long. We never knew that we could do it without going to the market for a few days, right? We never knew this, and we are all resilient, and congratulations for this. We know how to adapt with the changing circumstances. Some of us have taken it well, some of us could not take it so well. We have made a decision depending on the threats outside. We have thought positively in the past, and that is why we are here where we are. Physical resilience, very, very important. To have endurance, nutrition, eat well, recover well after sleep, maintain your strengths. Do not maintain your body in a way that you can endure this challenge of the pandemic. The social balance, we never would have thought that we would be speaking over Zoom calls so many times, over Microsoft webinars, over the online tools. We all have learned new skills over the last year, and that is what resilience is all about. We have had social support. We have been connected, though in a virtual way, but we have been connected, and this is the need of the hour, to be communicative with each other, to have our families also chat with each other remotely on video calls, on social media, etc. Spiritual resilience. Many of us understand the value of spiritual resilience. The core values, how we have the perspective in the future. Some of us can also look into the future. Those who are evolved with a much higher level of spirituality, as well as those, there are many of us, many of the people, the gurus who can calm themselves down and look into the future. And that is also a spiritual resilience, where we know that we believe that things will look up good in the future as well. During COVID times, life has become like this for many of us. Those who are working, they come to the desk, work, go sleep, and again come to the desk. So this has exactly been what our life has become. So it is tiring, it is draining, and added to that, the stress of so many negative news, so many people getting affected in the past, as well as today. It has been so critical for us to stay resilient during these times. We have been trying our best. All of us have been trying our best to overcome this challenge in the last 1 year. And we know that we are still not out of the woods. We still have a little way to go. We cannot tell people to be positive when they are going through such crisis. When people are going through a crisis of losing their loved one, not knowing what to do, not even getting the chance to give them a final farewell, you cannot tell that person, be positive, stay positive. You cannot really even console that person, because we don't understand the kind of grief that that person is going through. It is very, very important for us to stay rational and to give the strength of our being there. The strength of your being next to that person is so much more important, rather than giving an advice to such a person during such times. I have had people I have had young employees in our organization who got hospitalized with both parents, but came back alone. Both parents perished. The person became an orphan overnight after 3 days. So it became such a devastating experience for many of us. So during these times, we can just try, call, and be there for each other, advise them, if at all, give them support through a counselor, give them support with a psychiatrist. There are various self-help groups which various psychiatrists have formed, where people who have lost their loved ones can be a part of that group. When you are a part of that common group, you know that I am not the only one. There are people in my surroundings who have faced worse challenges than what I have. I am not the only one to have lost a parent. I am not the only one to have lost a family member, a sibling, a child. There are people around me who have gone through exactly the same or worse situations in the past. So resilience is also being connecting the dots, taking them to that person, helping them see the larger picture, rather than living in grief and breaking down in the future. I would say, just do your best and leave the rest. Play your part, spread awareness, tell people what they need to do, tell people to keep washing their hands, not touching their faces with dirty hands, not touching your faces or rubbing your eyes at all when you're outside your homes, in the market or in any shops. Please do not touch your faces or your eyes, because that is also known to have caused the virus transmission. Wear your masks. We always knew that virus was transmitted through droplets, airborne, and other things. The science keeps evolving. We keep learning new things. But the principle is, wear a mask. Mask is as good as a vaccine in today's times. Masks will not go away for the next 1 year, or it may stay for at least 2 years from today. And we have to get used to it whenever we are going out of our houses. We may still, even after getting vaccinated, it is very, very important for us to continue to wear our masks, to continue to maintain hand hygiene, and to continue to be socially distant with unknown people outside our homes. And even known people, you don't know who might be asymptomatic carriers as well. The first thing is reaching out early. And now I will talk about a little bit about the science of the virus. Reaching out early is so important in today's times. I cannot stress enough. I have had people, youngsters now, earlier on, my tonality has changed. Earlier on, we used to say that reach out early, but this virus affects only the elderly. Now, in the second wave, it is for everybody. Reaching out early for youngsters, for people in their 20s, 30s, 40s. Even if you have a fever, if you have a sore throat, if you have headache, fatigue, body ache, please reach out to your family doctor on day 1 or day 2. Do not self-medicate. Do not keep taking paracetamol for more than 1 day, because you don't know what you are harboring. The doctors will advise you some medicines, will advise you how to monitor yourself over the next 3 days, how to test yourself early, and then, if at all, unfortunately, you are detected as COVID positive, what are the steps that you need to do? We all need to do this COVID appropriate behavior. We all know that each one of us are at risk. It is not that मेरे साथ कुछ नहीं होगा, बाजू वाले के साथ होगा. It is not the case. The entire families, entire communities are getting impacted today. If infected, if you are infected, you may spread infection to others also in crowded spaces only by talking, speaking, or laughing. So you may put yourself or your family members at risk, and hence it is very important to remember the SMS: safe distancing, masking, and hand hygiene. Safe practices of sanitizing your hands. So safe distancing, masking, and sanitizing your hands. SMS is what you need to remember. And this is something which has not gone out of fashion over the last 1 year. Of course, mask, sometimes they say that double masking is better whenever you're going out, etc. But it is also the habit. Even if you put double masking, if you lower your mask and rub your nose sometimes, or keep your mask under your nose and don't and have a very loose fitting mask, it will not do you any good. There is something, and since we are in a scientific forum, I will tell you a little bit of the time and symptom based causality of this virus things. What happens if you are symptomatic and you are tested positive? If somebody is sick and the RT-PCR report comes positive, when can that person, this is in terms of rejoining work, and I have been asked by you also that you have your hostel, IWSA hostel, where people come from outside, people do, you don't know how to tell them to stay away, etc. So this few slides, the 4 slides, are exactly to tell you about this. If a person is sick and the PCR test is positive, what do? The government protocol is today that 10 days is the quarantine period for such a person who is PCR positive from the date of testing and asymptomatic, or 10 days from the time that that person started become symptomatic and was in home isolation or was in institutional quarantine. For 3 days, the person should not have fever without use of medicine. So once the person has completed 10 days, the person can come back to work. RTW is return to work. So 10 days, a person who's positive can be quarantined, isolated, and come back to work on day 11. This is as per the Indian government guideline also, which was amended a couple of weeks back. Why not wait for a negative test result? We don't need to wait for a negative test result after the 10 days, because as per the research, it is proven that after 10 days from the start of symptom, a person is no longer infectious and cannot transmit the viable virus, especially if they are asymptomatic. So you should understand that even if you keep on doing the RT-PCR test for a person after 10 days or 14 days, a person can show positive report even up to a month or more. I have seen 6 weeks. A person has continued to show positive results. That was in the initial part of the pandemic, when we did not know what it meant. So we kept doing tests and we kept waiting for a negative test before asking that person to come back. But it is known now that a test can come positive, but that person will not remain infectious to others after 10 days. So please remember this. You are not expected to repeat a test, RT-PCR test, after 10 days of a mild to moderate symptoms where you have recovered in your home. What happens when a person is asymptomatic? Like I was tested positive, I was symptomatic, I got all my people in my home tested after a few days and they came positive, but none of them are symptomatic. What happens then? When can you have that person join back? Again, it is 10 days. 10 days from the date of testing positive is what you will ask that person to stay at home in a separate room, quarantined, etc. The Ministry of Health and Family Welfare, MOHFW, the website has all the criteria and all the guidelines that is required for home isolation. Why not wait for negative test result? Again, the same thing. Even if you're tested COVID positive, in PCR test, research has proven that after 10 days of testing, a person is no longer infectious and cannot transmit the viable virus. Scenario 3 is you are, suppose, a close contact of a positive case. Like I met my friend, I invited my friend for a cup of tea. He looked fine to me. Then after a couple of days, he tells me, I have tested positive. I am scared then. What happens then? If I am a close contact without symptom, what happens? How many days should I stay in quarantine? So here, if I have been a close contact with a COVID positive case, I need to complete 14 days quarantine. And why is this more than 10 days? Because 14 days is the incubation period for COVID-19. So if you have had meaningful contact, meaningful means less than 2 feet, less than 6 feet, that means 2 meters, for more than 15 minutes is meaningful contact, then you have a chance to develop symptoms anytime in the 14 days from the last day of contact with your COVID positive friend or a neighbor or anybody else. So here, if you are a close contact, you should stay isolated for 14 days in your home and not go out in the community, because you have a chance of spreading of having the virus in the first place in your body, which may manifest as disease, as symptom over 2 weeks. And if you are really wanting to get tested, you should get tested only after day 6 from the last day of contact with the positive case. But remember, negative test is not an assurance that you wouldn't develop symptoms up to 14 days. So it is essential to complete the 14 days quarantine. If you can, it's better. If you are in an institution, it's better. But in the community, we cannot really enforce this because many of us do not or cannot follow these guidelines because not everyone knows these guidelines, even though the government has made it very, very clear that these are the guidelines. Finally, if you have symptoms of COVID but are not tested, if you have symptoms but are not tested, what happens? You please consult your doctor. In today's times, especially, last year it was okay because we knew that if you had mild symptoms, you could just monitor your pulse oximeter, your oxygen levels, and as well as the temperature. And if it is not coming very high, if everything is fine within 7 days, then it's fine. You don't even need to go to a doctor. This year around, it is a little different. This year, we are seeing some people get sick very soon, especially youngsters, especially those people who have not been vaccinated. And if you have typical symptoms, immediately consult your physician. And when can you join is, again, you should stay at home or stay in isolation for 10 days if they are typical symptoms of COVID, and which your doctor will tell you. Even if you're tested RT-PCR negative, it is better to stay at home for 10 days since the last symptoms have appeared. So these are some facts that are scientifically proven, and because of this, in a company as large as ours, we have prevented people from getting very sick during the first wave. We have not had any fatalities during the first wave. Unfortunately, last week we did have one, but that was because of the second wave, which hit us very badly, and with the lack of medical infrastructure that is in the north of India, we are having a lot of challenges in many cities, in small towns, etc. And that is how we have been trying to save our people as much as possible. Working, my entire team has been working almost 17 hours every day in the last 1 year. So important facts is PCR test, your RT-PCR test that you know becomes positive only after there is sufficient quantity of virus present in the system. Chances of it turning positive is more after day 5 or day 6 from the day of contracting the infection. That's why your doctor may tell you, once you start getting symptoms, please wait for 2-3 days before you go for testing. Some people who test early, the report may come as negative, and then you say, "Arey, mera negative aa gaya," but still I am unwell. Still I am getting these problems, and suddenly you land up in the hospital because your symptoms have become very major and severe. Remember, a person may develop symptoms of COVID anytime from day 1 to day 14 during the incubation period. Okay, so symptoms, if you have had a household member, all the household members need to be monitored and asked to be isolated for 14 days from the last day of contact with their COVID positive household member. PCR test, as I have said, can come positive even after 3 to 4 weeks after infection, as it keeps picking up virus remnants of the sample. Even though there is no active virus and person is non-infectious, it can still come out positive. No cause of worry. Do not keep repeating your PCR test after, just to see whether it has turned negative or not. If a person is in the hospital authorities do repeat tests, because in some people who are in the hospitals, the course of the virus is a little longer than a person in the household, right? So it is not used for screening as well. What about positive rapid antigen tests? It has to be backed up by a PCR test. However, this is another fact, and I am sure all of you would know this. A positive PCR or a positive rapid antigen test are true positive. If you have tested positive in either one, you don't need to test again just to see if it was false. If it has come out positive, it is a true positive. However, if it has come out negative, it is good to test again, because in rapid antigen testing, the sensitivity is just 50%. There is a 50% chance of the test coming negative for positive people. So you have to be aware that rapid antigen test is not sensitive enough. Even PCR test is not sensitive enough. It gives you a positivity rate of around 70%. So when you say that, "Arey, main test karke aaya, mera test negative aaya," but the test did not give me negative, it was false, and I still have the symptoms. The doctors, what they do is, if you are still having symptoms after 2 days, they ask you to test again, because of the pure reason that sufficient quantity of virus may not be present in your nasopharyngeal system to be picked up in the swab. The other thing why there are so many negative reports is because in today's times, a lot of qualified technicians, lab technicians, people who go to collect samples, they themselves are sick. They themselves are afraid. They themselves could be in quarantine. So they have enrolled a lot of people to do the testing, and not everybody is as skilled or qualified as the original person. So you have to take that also with a pinch of salt, that the person that you don't want to go to a lab and you want home collection, The person who's coming to your home may not be qualified enough to collect the sample well. So please keep that in the back of your mind when your reports are coming negative. Why it is negative? There are a few reasons of why it can be negative. The other reason also could be, and that is still to be proven, but it is a very anecdotal evidence that we are seeing, is the new strain may not be picked up by the RT-PCR test kits. Okay, so many of us who are showing typical signs of the virus, even after proper testing, even 2 samples back to back may be coming negative, could be because the RT-PCR kit that is being used in the lab may not be sensitive enough to pick up the new strain. So these are some of the scientific evidences that I wanted to give to you. Secondly, what happens after COVID? Do everybody recover well after testing negative for COVID? Please remember, it is very, very important to keep a watch on your symptoms that might show up. Over 80% people recover fully. Up to 20% have symptoms that may be prolonged, even in young adults and children, without any underlying chronic medical condition. So 80% no problems, 20% could have symptoms that may last beyond the 14, 17, 20 days from the start of symptoms. So we have to be sensitive to such people, because we cannot tell them, you should have recovered by this date. Why are you not ready yet, etc. Some people still have a lot of fatigue. Some people still have some blurry vision, some mental fogging, etc. So the medical community is still learning more about those who are recovering from a milder coronavirus infections. And those who have high blood pressure, mental health challenges, obesity, etc., they have higher increased persistence of symptoms as well. So these are complications during recovery after having tested negative for many of the COVID cases. Fatigue may continue, cough, mood changes, breathlessness, sometimes shortness of breath may continue for about a month after recovery as well. Headaches, joint pains. Sometimes the lung becomes fibrosed because the virus has impacted you. So that is pulmonary fibrosis, damage to the heart, to the brain, because we know that this virus is also causing microscopic thrombus to occur in the thrombus means clots, small microscopic clots which occurs in the body, and that's why doctors advise you to do a test called as D-dimer to see whether you are at risk, and if it is high, some doctors may prescribe you some blood thinners to take care of these clots, which can have the potential to damage your heart, your brain, and your lungs as well. So it is important, please stay in touch with the doctor. If the doctor is asking you to do a few tests serially, please do the tests, because it is important to prevent any long-term complication from coming up because of COVID. What are the care to be taken after? I'll finish in 2 minutes. I'm almost done. What are the care to be taken after having tested negative? Please take rest. Very, very important. Even during the course of the disease, take rest, drink warm water, practice breathing exercises and meditation. Very important to calm your mind, because the positivity of the mind will help in your recovery as well. No smoking or alcohol during the course of the disease. Do not meet strangers, and follow the 3 rules of physical distancing, masking, and hand washing. Eat healthy, take rest. 7 to 8 hours sleep a day is very, very essential for recovery as well. So paying attention to small complaints like fever, cough, difficulty in breathing, chest discomfort, are all very important even after a person has tested COVID negative and a person is experiencing those symptoms as well. The change of medications are very important. If your doctor says that because of COVID, your sugar level has shot up, you have to increase your dosage of sugar, diabetes medicines. Please listen to your doctor, because the doctor is not doing something out of his own free will. COVID does trigger a spike in blood sugars, as we know, and do not stress yourself by thinking about the disease. And stress lowers immunity. What I wanted to also tell you is it is very, very important that we all understand that what looking at all the news, you know, is only increasing the negativity around us. And we have to follow, we should not be making analysis. Analysis is for the healthcare professionals and government authorities to analyze and present to us the statistics. The statistics might be very scary, but please do not let it consume you and be the topic of your discussions throughout the day. Speaking about negative news will not be helpful at all. It will not be helpful. Please try to stay positive, speak on the positive, work on your vocabulary as to what you're telling each other, what you're talking to your friends over the phone. Talk about everything else. Remind and create awareness of the COVID appropriate actions. But please do not speak constantly on what negative impact the virus may cause. Be certain in your mind to help overcome the fear that is there within us. Take care of your lifestyle, but the thoughts are very, very important. Being healthy in both physical and mental, and improve the energy around us. It is all I have heard so many talks by various spiritual gurus, uh, Sister Shivani, Sadhguru, and others to improve the energy around us. Don't create fear and panic among others at home. Your thoughts and words will create positive energy. So it is very important that also we continue to do the regular exercise, regular walks, whatever is required, or regular exercise within the homes, which means less risk of developing a severe infection because our bodies also need resilience. And in a recent study, and if I could just take a minute, in a recent study in the US, over 48,000 people were enrolled in the study. It was found that those who had been most active before falling ill were the least likely to be hospitalized or succumb to the illness. So please take time to go out for a walk, a run if you can, or at least do some kind of meditation, breathing exercises, which will also increase your resilience. And medical recommendation is brisk walking for 30 to 45 minutes daily for 5 days a week at least, and it helps our body cells repair and recover as well. So please, and regarding vaccines, if you or your family members are eligible for the COVID vaccine, everybody is eligible about today, but subject to availability, please go ahead and get the jab. I was vaccinated and I got infected after my second shot of the vaccine, but you know, the virus did not cause too much harm. Thankfully, I just had a half day sickness and the next day I was back to work. So it is seen that people might get infected even after 1 or 2 shots of the virus, but they are definitely protected from severe disease and severe illness in the times to come. So that's all from me. Thank you very much. If anybody has a question, you can definitely ask now, or I would be happy to also stay connected on over my email. Thank you very much, ma'am.
Thank you, sir. Thank you very much, sir. Thanks a lot. We all have learned a lot and understood much more about this importance of I can, how life changes between I can and I can't. The ability to utilize our inner strength to bounce back from setbacks is what is the need for the hour. Your talk really made us understand it quite in depth, which people like me, at least I can talk about myself, a person like me really learned a lot today from your talk. And I'm sure all the participants, all those who are here, they must have learned a lot and will go home much better understanding about how to behave here. Sir, regarding your this going back, you took us back to think about our toughest time. in our life. And that really, I'm sure many of them have done it in the chat box. And it gives us the strength to come back again. So even today, we will learn that today also we need that. We have to come back. And that single trait will really helpful to will be helpful to us. Bouncing back, we all will be bouncing back. That's right. And parents, as you said, parents, if parents are resilient, kids will also learn that thing. So we have a task for ourselves, all of us, to be resilient and teach us children also to do that. I like that thought in your this one of the slide, that which does not kill us makes us stronger. So that is very true, sir. Thanks a lot for your this. And now I will like to see the question answers which are given. I will go through it and you please keep on answering it, sir.
Yeah, please.
We have from Mr. Balakrishnan, we have lots of information he has given to us. I think we will learn about that. We will read about it. Then when you said that what is that which are making us fight for those days. So lots of things are given here, attitude, solution. There is a solution to every problem. This time will also pass. Madhu madam said, my determination to move ahead in life and not look back. Yes, faith in Almighty. And then Devki ma'am also said, faith and trust in God and myself that I shall overcome. Again, Mr. Balakrishnan has given lots of information regarding WHO and all that. Excellent. Everyone says happiness improves your immunity, fears back. Thank you for increasing our happy hormones. That's from Madhu madam. Yeah. How effective are the preventive medicines like ivermectin? That is from Lalita madam. How effective is this medicine?
Yeah. There are many medicines that are being used today. They are called repurposed drugs. Ivermectin is actually an anti-parasitic medicine. It used to be used to kill worms in the body, but now it is being repurposed because it is seen that it has a good penetration into the lung tissues as well, and it has some element of protection when it is started early in the first couple of days of exposure, or if or the start of the symptoms as well. So it is very important that you listen to the doctor. If the doctor prescribes it, please take it. It is a part of the protocol as well of treatment in today. So it is not a COVID medicine, but it is a repurposed medicine to be used during COVID.
Yes, sir. Thank you, sir. Devki Ramanathan madam said, should we keep some oxygen at home? At least the cylinder people carry for hiking as an emergency measure.
It is a choice, but you have to also decide and understand how much time will that oxygen cylinder last you. If we are using an oxygen at the rate of 2 to 4 liters per minute, and the small cylinder of oxygen only has something around 80 liters or even less, sometimes it is 50 liters, will it last you for more than 20 minutes? Okay.
For emergency, until you reach the hospital for help.
But ma'am, when a person, it is more important to have a pulse oximeter in your homes. So when a person is measuring the pulse oxygen levels and the oxygen level is falling below 95, that is the time when you should reach out for help and also consult a doctor. The doctor will tell you whether you need an oxygen concentrator or oxygen cylinder in the house, but don't go out and purchase. And I have seen a lot of people in North India and Delhi especially hoarding 14 cylinders in their homes for no reason. And that is the reason why the artificial shortage is there created in the community. The people who actually require oxygen are not getting oxygen, and the people who do not require oxygen are having 14 to 20 cylinders in their homes. So these are some things which I will not get into controversy, but please listen to your doctor. Your doctor is the right person. I would say today that please purchase a pulse oximeter and keep it in your homes. There is something called as happy hypoxia. Happy hypoxia is that you may not feel it, but your oxygen level is slowly dropping in your blood. It is not to make you scared, but that is what COVID does in some people. So if you are seeing that your oxygen saturation in your blood with your pulse oximeter is reducing below 95, or after a 6-minute walk test, that is very important to understand. I did not tell that, but 6-minute walk test is something which is a critical marker for COVID. If you have been exposed to a person or if you are feeling unwell, you should do a pulse oximeter check of your oxygen saturation before and after a 6-minute walk in the house. Okay, if there is a difference of more than 3% before and after, then you should consult your doctor immediately and tell the doctor that I have had a drop from 98 to 95 or 96 to 93 or more than that, and your doctor will tell you what is to be done as next steps. So it is very important to rather have a pulse oximeter and a thermometer in your house for checking your health status in these times.
Dr. Paul, this is Rita. Could you just quickly tell the best way to measure your oximeter reading? Like, don't wash your hand in cold water and come and test. That sort of. A common sense, proper manner. Can you please tell that?
Yes, ma'am. Thank you so much for this question. A very important question. Even if you wash your hands, it is good to just rub your palms so that your hands are not cold enough. Some of us with age, our extremities do turn cold, and or else we are sitting in an air-conditioned environment. It is good to just rub our palms, warm our extremities, wait for 10 seconds before putting on the pulse oximeter. Sometimes we panic because pulse oximeter is not showing a reading above 90. It is good to also see whether you're wearing a nail paint on that finger, because nail polish also will not give you a correct reading. So if something like this is happening, please also measure in the other hand as well, in the other fingers. Okay, so something you can check. You can also use a pulse oximeter in your foot as well. Sometimes you can use it in your toes to also check. So if something like this is happening, you're panicking, please reach out. There are a lot of teleconsultations that the doctors will do and also tell you about these things. And Rita ma'am, very good question. Ensure that your hands are not wet, your hands are dry, you are not doing an alcohol rub and immediately putting the oximeter, etc. Let your hands dry, let your extremities warm up, and then check for the oxygen saturation.
Thank you very much.
Thank you, sir.
Excuse me, can I ask one question related to this only?
Yes, ma'am.
Doctor, I tried both the hands, and sometimes there were different readings given by the pulse meter. Is that correct?
If it is just a different reading, means just by, there can be an aberration by 2, maximum 2. If it is more than that, then please speak to your doctor as well, because sometimes, and this is pre-COVID times, I am just telling you, we have found out clots in the arteries just by using the pulse oximeter as well. Okay. So if there is a clot in the hand, and minor microscopic clots, the blood supply is not proper, and that may also, even in old people, there might be a difference between the two hands. So please consult your doctor as well.
So repeated trials can be done?
Yes, of course.
At regular intervals to check that, as you're saying.
Sure, you should.
Okay. Thank you.
Thank you, sir. Thank you very much. There were number of compliments in the chat box for you, sir. I think it will take a lot of time to read each and every one of them. So cutting short, thanks a lot. Your talk was very informative. Really learned a lot. Thank you all.
Thank you so much, ma'am.
Sir, I just want to ask one question, please.
Yes, ma'am.
Sure, ma'am.
Sir, if the pulse reading is coming below 60, what are we supposed to do then?
Is this a patient or this is a normal citizen?
It's a normal hand.
If you have not already done your baseline check in the past, and if you are seeing that pulse rate is reducing, is decreasing, dropping recently, because after a fever or something, low pulse is also an indicator that is seen in some COVID cases as well. So it is good to also check with your doctor, because the doctor can ask you to get an ECG done, can get you some other things done as well, some other tests, which will be useful for determination. But 60 is not a cause of concern if for some people whose baseline has always been somewhere around 60 to 70.
Okay, thank you, sir.
Thank you, ma'am. Thank you, sir.
Thank you.
So now it's the time to say vote of. Friends, I sincerely thank the audience for their patient hearing and always encouraging us throughout our programs. It was indeed a pleasure to have you all for this program. There is always a lot of hard work put up for days together to bring a show for the audience on this stage. And my big thanks to all those working hard behind the stage. I must thank the technical team, Tripta ma'am, Suparna ma'am, and Rajeshri ma'am for their untiring efforts for bringing this flawless program on the virtual stage. We all are grateful to each one of you, dear friends. Now, I will request all of you to join us again in the month of June for another talk. We will share the details very soon with you all. I request all of you to block the date, please, when we mention the date. It is not right now, not confirmed. So thank you. Goodbye. Stay healthy and follow the practical advices given by Dr. Paul today. I assure you, we all will be definitely more happy, healthy with ourselves and with people around us. And please get, as doctor said, get vaccinated if not done so far. So, and wait for our next program details. Thank you all. Thank you very much. And here we end our program for today.
Thank you, ma'am.